We are back with Intermountain Park City Hospital. Their administrator and CEO, Lori Weston, is joining us today to give us an update on everything happening at the hospital. Lori, thanks for talking with us.
Absolutely. Thanks for having me.
Well, everyone within our county is talking about this new health order. We're curious about how things are going at the hospital, how it's looking for patients. We assume there isn't an overwhelm because we are able to move to this next phase, but how are you feeling? How is hospital staff feeling about this new phase of opening things? And are you optimistic or a little concerned?
We're optimistic. I think if people are disciplined enough to know that they still need to continue the social distancing and wear the proper face shields and wash hands, follow those procedures that we've been communicating over the last 6 weeks. I think that we'll do fine. We just hope people continue to take it seriously. This isn't going to go away. We're just really trying to open up businesses and get people back to work safely and control the virus in our community.
Now, when we talk about the hospital and we're curious about how things are happening with patients, we look at emergency room numbers. Are you still seeing COVID patients? Are you seeing kind of a mix of COVID patients as well as what you normally expect during this year? How is the emergency room looking right now?
Volumes are down in the emergency room. We're seeing a lot less of COVID positive patients in our facility, which is a good sign. We are seeing more of what we typically see this time of year. People are recreating, so we're seeing a little bit more of, mountain biking and outdoor activity accidents that we usually see. So more of a mix right now, but manageable and not too alarming for sure. We do have visitor restrictions in place still, and those won't ease up here at the hospital. As the county eases up theirs, the hospital will still be offering curbside service. You'll be checked in your car when you arrive at the hospital for respiratory illnesses. You'll be masked. We make sure everybody stays safe. No visitors are allowed with very few exceptions right now, just to make sure we're keeping our caregivers safe and also keeping the patients safe that are coming in to see us.
And some of those exceptions with visitors at the hospital is you are allowing visitors if someone's at end of life. Also, when someone has a baby, they're also allowing visitors. So you are thinking about this balance between being very, very safe, not spreading the virus potentially, but also making sure that your patient's well-being is at the top of the list.
Exactly. Yes, we want to make sure that we're keeping everybody safe. The hospital is probably one of the safest places to be right now, so with the measures that we've put in place to take care of individuals that come in for care. We still are seeing people that are non-COVID related. It is very safe to come to the hospital. We keep respiratory patients separate from patients that are coming in for maybe some normal visits, imaging labs, those types of things. Everybody's masked. No one's allowed to wait in the waiting rooms. People wait in their cars until their appointments are available. So we're doing everything that we can do to make sure we keep people safe when they need our care.
And before those allowed visitors are welcome into the hospital, is there a process that they have to go through? Do they have to be checked? How is that happening?
We do. So we can have them come up to 2 entrances during the day. You can enter in through the emergency room entrance or the main entrance. At that time, you'll be greeted with someone in your car, and we'll find out what you're here to visit us for. We'll give you information on how you either call in and pre-register if you're here for a surgery or a lab or imaging. You'll call that department's number. They'll let you know when they're ready for you, and they'll call you back, and then they'll escort you to your appointment and then back out to your car when you finish. You'll be given a mask, hand sanitizer, and those types of protective measures.
Now, is anything changing at the hospital with this new Summit County health order? Are you seeing more patients? Are you still doing what you have been doing throughout this entire crisis, which is trying to do as many telehealth visits as possible, limiting the amount of clinic visits within the hospital? Really, is anything changing drastically?
Not drastically at the hospital. We're going to still stay at a high risk just because when people are sick, they come into here. And so we want to make sure that everybody's protected when they come into the hospital. You can still access the emergency room safely. Our clinics are open and can attend to your needs as well. Call your physician's office. They'll let you know whether your appointment can be done by video visit. And if not, they can make arrangements for you to be seen here at the hospital. Same with physical therapy. We'll be able to take care of physical therapy needs. As you know, we also started elective surgeries this week, which has gone very well. We're doing a lot lower volumes than we've seen before, but patients that are coming in for surgery are definitely, definitely a more protected process. There's no visitors. We make sure we're, practicing social distancing, and the way that we take care of surgeries now is a lot different, and it'll probably change for the future of how we do surgery in the future.
And Intermountain has been collecting homemade face coverings through some service projects of very generous individuals who are taking the time to sew these masks. I'd love to hear more about that project.
Yes, Intermountain has partnered with the University of Utah and the LDS Church to have homemade masks made in order for us to be able to protect patients and caregivers. We really need masks that we can hand out to patients that are coming into the hospital, so we're not using surgical masks that are in short supply right now. So if you have masks, we'll welcome them. We have a drop box here at the hospital, at the front of the hospital, that you can bring those by, or you can reach out to us as well and let us know how you can help. But masks are really important to get out into the community so patients can use those. And if you are coming to visit us, please bring a mask, or we will issue you one as well.
Well, thank you so much, Lori, for taking the time to speak with us this morning. We're so appreciative of everything that you are doing, for you spending your Friday morning speaking with us. And please let everyone at Intermountain Park City Hospital know how grateful we are for their hard work in keeping our community safe during this time. We have more right after this. We'll be right back.